I had a patient that had the device for 3 weeks, and she came in, and I asked her how she's doing, what percentage of her initial symptoms are, and she said 0. And on top of that, again, it's getting worse. It's getting worse. My pain is getting worse. I wore it 24/7 for 2 weeks, and I haven't had it in for a week. It hurts so much. So I went through the usual, okay, that doesn't happen. That honestly, that does not happen unless there's some kind of really unusual circumstance, which we're going to talk about in this case, or they're not wearing it, or the device is not set up correctly. Got to make sure the device is set up. There isn't any posterior occlusion. So I checked that. That was negative. Device was set up correctly, had good posterior disocclusion, good anterior even occlusion across the anterior 6. So as I'm talking with the patient, going through the litany of, well, why aren't we getting this out? And I thought about, well, we're only 3 weeks. I didn't feel that the vertical dimension needed to be increased at that time. She was getting more pain. And as I'm sitting there talking to her, I'm literally watching her do this, protruding the mandible. Now, that's not an intentional thing on her part. She was not aware she was doing that. But the point is, I brought it to her attention. You can imagine if someone in a device or out of a device for any reason is constantly protruding their mandible, they're disoccluding the condyle in the glenoid fossa. Just like if you have somebody pulling on your leg all night long, disoccluding the knee, how much your knee would hurt in the morning. Or if you did it during the day, how much it would hurt when you tried to eat, when for the prior 8 hours, you were just disoccluding the mandible, which is what one of the primary causes are for TMD, which is functional malocclusion, where the condyle does not seat in the centric relation and is constant pulling apart and putting together, mashing together